Module 5, To Learn and to Unlearn. Learning new responses to pain can be an important piece of managing pain. One example is learning a new way to respond when feeling some emotional or physical discomfort. An automatic response might be clenching muscles or holding your breath. Both can set your body's stress cycle in motion and increase pain levels. Let's look at more adaptive and thoughtful responses, perhaps some gentle movements or 1 minute of simple breathing. What is learning? Learning is neuroplasticity, or your brain rewiring in action. Think of a child learning new math facts, someone playing an instrument or hitting a ball. Each skill improves with repetition. This simple science is behind the expression, practice makes perfect. Nobel Prizes have been won showing that 2 ways we learn something better are what we think and what we experience. What supports learning? Parents and teachers have long said, pay attention. Before tossing this idea aside as a duh moment, let's look at the science. As we pay attention or focus, certain neurotransmitters, acetylcholine is one, are secreted. Research shows that acetylcholine levels increase as we move, yet another reason that school recess and short stretching breaks are important. For our purposes, it is enough to know that to learn new things, you really do need to be paying attention. What inhibits learning? Long periods of stress can inhibit learning. Consider how poorly primed for learning you might be if you did not have enough food, get enough sleep, or feel safe. Studies show that long-term stress can inhibit the formation of new memories, which is learning, and over time can kill neurons in the part of the brain that first encodes memories. How do you unlearn a response or a habit and learn a new, more adaptive response or habit? Even if not all the mechanisms of pain are understood, we can still work with what we do know and what we have observed to be helpful in pain management. One inspiring example of the possibilities for unlearning pain is in The Brain's Way of Healing by Norman Doidge. He devotes a chapter to the case of Michael Moskowitz, a pain doctor and founder of a pain clinic in California to treat patients who have run out of treatment options. Dr. Moskowitz suffered from chronic pain from an injury for over 10 years. His story inspired the noticing breath in this book. The noticing breath gives some easy guidance to the advice, just breathe through it. You continue to notice the area of pain or discomfort on both the breaths in and the long, slow breaths out. Clenching the muscles and holding the breath are replaced by simple actions that can lower heart rate, lower blood pressure, and lower muscle tension. It's not a one-time cure, but something to practice to unlearn a pain response and to learn a more helpful one. What's the takeaway? How are stress and learning and the HPA axis relevant to pain? We know pain can cause stress. We know stress interferes with learning. If someone is so stressed that learning new things is a challenge, the first step can be to create strategies to use in real time that empower someone to lower their stress levels. Practice simple breathing and stretching to lower stress. Over time, using this new pain response can weaken the learned stressful response. It's a way to put use it or lose it to good use. Someone can choose to change a response and over time create a new habit. You may see how these ideas are coming together. Teaching someone to self-regulate and to learn more adaptive responses is supported by strategies based on building safety, supporting empowerment, and maintaining simplicity. These ideas are the core of the Green Tree Yoga approach. Trauma-informed yoga for pain management puts all these ideas together. If you like, give yourself a few moments for a short break. One way to manage pain is with gentle stretches to reduce pressure on nerves and joints. When you are ready, stretch one arm to the side or overhead. Fingers stretched wide in the tip-to-toe stretch. Then stretch the other arm, either to the side or overhead, fingers stretched wide. Find your own rhythm as you stretch one arm and then the other. Take your time with each stretch. Today you may like to arc one arm overhead and then the other. Find your own rhythm as you move. If you like, gently stretch the fingers on one hand or shake that hand. Then gently stretch the fingers on the other hand or shake that hand or shake that hand. When you are ready, gently press one shoulder back, then press the other shoulder back. Longer breaths out can lower heart rate, lower blood pressure, and lower muscle tension. If you like, put one or both hands over your heart. Put one or both hands over your heart. The suggestion is to practice 5 breaths. Feel the breath in. Feel the breath out. Feel the breath in. Feel the breath out. Always breathe in a comfortable way. Feel the breath in. Feel the breath out. Feel the breath in. Feel the breath out. Feel the breath in. Feel the breath out. If you like, gently move the fingers on one hand or shake that hand. Then gently move the fingers on the other hand or shake that hand. If you like, give yourself a few moments to notice how you feel